There's no shortage of debate in this country about health care and about immigration. So when you combine those two hot-button topics, the problem becomes even more contentious as some U.S. hospitals are becoming fed up with having to care for uninsured immigrants on their own dime. So where does the responsibility lie? With health care providers, immigration officials, or somewhere in between? Emergency room doctor Lee Vanoker and immigration lawyer Glenn Wasserstein join us now to discuss this matter. Dr. Vanoker, there was a case not long ago where an illegal immigrant goes to the hospital and doesn't have any health insurance, doesn't have any money, and the hospital made a calculated judgment, stabilized the patient, put him on an air ambulance, and ship him back to the home country. In other words, the hospital sort of deported this person.
Well,
has it gotten that bad for the hospitals?
Well, this medical repatriation, as it's called, I mean, this didn't happen in the emergency room. I mean, this patient had a severe brain injury, and he had been in the hospital for years, racking up millions of dollars. He couldn't be transferred to a lower-cost long-term facility because there is no insurance for illegal aliens, where an uninsured American citizen would eventually get coverage for lifetime care. So it's a sticky situation. The hospital had had this man there for years racking up bills before they sent him back. They have supposedly talked to the health minister in his country. But it's a tough call because it affects all of our health care.
Glenn, that particular case aside, the real question here is, should public and private hospitals be burdened with the cost of caring for people who are here in this country illegally?
Well, let me say that it's not these hospitals' fault that they're in this situation. It's the federal government's fault for failing to enact comprehensive reform and actually solving our broken immigration system. That being said, this is the perfect intersection of two of our most dysfunctional systems, the immigration system and the healthcare system. The law is very clear in this situation. The federal government, and only the federal government, has the authority to determine someone's removability. The federal government, and only the federal government, has the ability and the authority to actually remove someone from the United States. So allowing these small private organizations to determine removability and then actually removing them is a recipe for disaster.
But I'm going to ask my question again. Should the hospitals have to bear this cost?
No, the government should be bearing this cost because it's the government's fault for allowing this situation to balloon into what it's become.
But when you say government, you're saying taxpayer.
Unfortunately, the government has allowed this to happen. 30 years of government inaction has created such a massive problem that we have to deal with it.
How serious is this problem, Dr. Vanoker?
Well, it's a very serious problem because, first of all, it affects everybody's access to care. These small hospitals in border towns then become insolvent once they're absorbing all this cost. Now, EMTALA, which is the federal law that states everybody's taken care of in an emergency, is a good law, but nobody states who pays for it. And we're all bearing the brunt of it, and it's causing overcrowding in hospitals, hospitals to close, loss of ERs, loss of hospital beds, and it's going to affect your care and mine.
I'm running out of time, headed to a hard break. Thank you both for joining us here. Greatly appreciated. With sky-high gas prices.